My name is Ann Fuquay, and I'm with the Alliance for the Treatment of Intractable Pain. I've been on approximately 1,000 MME for over a decade and have had obvious benefit without any side effects. I can't begin to tell you how much my quality of life and ability to be independent has improved. Doses like mine aren't appropriate in most cases. Most of the ultra-high dose patients like me have not been nearly as fortunate. Even most patients who have genuinely benefited have been tapered as a result of the push to reduce opioid prescribing. Tapering has even the patients who truly benefited from the higher doses have been tapered beyond what they can tolerate, to the extent that their quality of life is almost non-existent. Getting out to come to a meeting like this would be impossible for them. In 2015, my doctor, who I'd seen for 9 years, closed his pain management practice. What followed was the worst experience of my entire life. I've been incredibly blessed and able to return to my previous dose. 3 years, though, and I'm still not back to normal. Pain, not withdrawal, caused my blood pressure to elevate to stroke levels. This was despite large amounts of clonidine and nitroglycerin. I now have significant short-term memory deficits documented through neuropsych testing. I often do things that remind me of my grandmother when she was early in the course of vascular dementia. I chose to stop driving. I definitely do not live in a city with the mass transit resources of Washington, D.C. But I'm incredibly grateful for the life that I have, because it requires a 4,000-mile round trip every 3 months. The trip from Alabama to California is brutal, and the associated expense has been a huge financial burden. My question: how do we enable healthcare providers to be pro-patient and ensure long-term patients who are stable on high doses continue to have access to those medications?
Thank you for that question. Who would like to take it? Patrice or Dan?
Thank you for your comments, and I think you represent the issue of individualized care and the importance of individualized care. I think most people might look at a high dose and say, wow, how can anyone function on that dose? You can, and so we have to look at patients, not dosages. So thank you for sharing that story, and the AMA has been steadfast in our commitment regarding decisions regarding to treat or not to treat, and how much should be between the patient and their physician. But I think we learned earlier that there are all these other external disincentives to do so. I think your question about will prescribing go down if there's a threat of the DEA coming, absolutely. And so we have to do whatever we can to make sure people are aware that the threats, worrying about the letter you saw in the AJC and the doctors with the high prescribing getting a letter and how that will impact your patients. Remember, as a physician, my license and my ability to practice is my livelihood. If I can't do that, what am I to do? And as the child psychiatrist, I should make sure that I continue to do that. So I can tell you that at the AMA, we will continue to advocate with the pro-patient. And doctors, you're right, should not have to be afraid.
Thank you, Patrice. And I would just add, Dan made the point that we need more team-based care, which I wish we had gotten to. And if I could extrapolate from what Jessica said, patients have to be part of the team. It's not just clinicians, it's the patients and the families in this case.